Yeah, I think most often when we see failure of these hybrid cases or full arch implant cases in our office, it has to do with the engineering of the case from the surgical standpoint. Oftentimes when I have patients in the office for the consults, we start talking about engineering, and by no means am I an engineer, but I kind of use the analogy is if we put in, a trailer on a campsite, then you don't need as many pylons in the ground to support that trailer as if you're building a 10,000 square foot, 3-story mansion. You need a lot more pylons in the ground for support. So, I think a lot of that has to do with engineering the case for, with the patient's wants and needs and our end goal for the prosthesis. And that is oftentimes overlooked, whether it's too many implants or too few implants or implants in the wrong position. It doesn't allow for good structural support, or there's too many implants in there for somebody who doesn't have manual dexterity to clean in between them. And if they can't clean in between them, it doesn't matter how many implants we put in there to structurally support it. If basically they have issues with cleansability, it's all going to fail, at some point, because they can't clean it. And that's how they got to our office initially. So, they had trouble cleaning things.
Yeah, that's a big thing, and that kind of falls squarely on the prosthodontist and the technician to give contours. That as the prosthesis comes out of the implant through the soft tissue and into the mouth, we have to give contours that are cleansable. We have to be able to give them something that they can clean. And the other thing that I see that causes failure is improper management of occlusion. So, especially if patients have, if they have a full arch and they have teeth on the bottom, but they have a roller coaster plane of occlusion that hasn't been addressed prior to doing the surgery, now we can have some problems.
Well, just what they did with their teeth that caused them to lose a teeth initially. Mm-hmm. I mean, if we have somebody who's grinding their teeth and grinded their natural teeth completely away, you're going to use different materials than somebody who just lost their teeth because of periodontal disease and bone loss. So those are the things that we look at to where from the prosthetic standpoint on your end, you're going to look at, okay, what did they do to what God gave them, and how can I best give them something that can prolong what we give them for as long as terms possible, to give them a good result. So those are the things that I think that'll help set us up to have the minimum amount of failures. And sometimes less is more. Getting back to the cleansability thing. You hear all the people on when we talk about the all in 4, all in 5, or all in 6. A lot of people get caught up on how many implants, and it's not about how many. It's where they're placed, and it's the distribution, and then cleansability of them. So those are the things that we look at. That in the initial consultation, because we do this all day, every day, we can look at a patient, talk to a patient, get a feel for what they had in their mouth previously. Manual dexterity, if they're going to clean it, they're not going to clean it, what their habits are, and talk to them about all these things, and then offer them the best option, to get that long-term success and avoid failures.
In improper design of the restoration, some people that are in fixed need a removable, and some people that are in removable maybe would benefit from having something that's fixed,
And I think what happens to a lot of these patients too is they come in and they get their 4 to 6 implants and their new prosthesis, and then they're off to the races. You don't see them. They may go 12 months, 18 months, 2 years without checking in, having, oral hygiene, and the bite changes. And that's what really causes a lot of the problems is the bite forces and the bite changes on these prostheses, especially for patients that are grinders, that are clinchers, that are putting a lot of what we call parafunctional, forces on these implants. And once again, they get their teeth and their implants, and they think, I'm done. I don't have to brush and floss and take care of them, and that's where a lot of patients get into trouble.
Yeah, these patients are essentially, and what I'll tell them is, you get in a new car, You just traded in your old car for a new car. If you don't change the oil, you don't rotate the tires, you have problems with the new car, you know? So you have to come see us, you have to maintain it. And you know, I think we're all very, very, very good at talking to the patients and talking about maintenance programs and things like that, to where you still have to maintain everything that we do, because, you know, if you don't do your part when you leave our office, you know, you're driving the car off the lot, I don't know what's going to happen to it, you know, but you got to do the maintenance just like on everything else.